going to draw a quick four square to help you remember the type of signals that we have. If you remember this four square, you can never make a mistake. We know that signals are either motor, that is an outgoing signal, or they are sensory, that is an incoming signal. Signals are either somatic, going to the body, that would be skeletal muscle, or they are visceral, that is smooth muscle, cardiac muscle, or gland. It has to be one of these four possibilities. So if we have a somatic sensory signal, that means that we are feeling something from the muscles. This, for example, would be like a muscle cramp. We're feeling something from our somatic, our body. We can have a visceral sensory signal. This means we're feeling something from a visceral structure, a smooth muscle, cardiac muscle, or gland. This, for example, would be a heart attack or an upset stomach. We're feeling something from an organ. We can have a somatic motor signal. This is a command that we are going to send to a skeletal structure. For example, we are going to tell our hand to move, we're going to tell our voice to talk, we're going to tell our body to do something physical. This fourth situation, visceral motor, is where things get a little bit tricky. Remember, we had a somatic motor signal. We can tell a muscle to move or to not move. We can raise our hand or we can not raise our hand. The consequence of raising our hand or not raising our hand may not be important. A visceral structure, however, we don't ever want to turn off completely. You don't ever want your heart to stop beating completely. You don't ever want to stop breathing. Instead, you want your heart to beat faster or slower depending on the situation. So visceral motor is always going, but we can have it go sympathetically, so that's SY. Sympathetic, that is our fight, flight, or fright. This is our go pedal. This makes our heart beat faster. This makes our lungs bring in more air. This is sympathetic. Or we can have a brake pedal. This is our rest and digest, which is a parasympathetic. And parasympathetic is our rest and digest. So it is going to slow down our heartbeat, slow down our breathing, but it's going to increase our digestive system, our rest and digest. So somatic motor is under voluntary control. This is what we're thinking about doing. We can decide to have an action or not have an action. It's a no-go, no-switch. Visceral motor is involuntary. We don't think about increasing our heart rate. We don't think about digesting our food. It just happens. But it happens faster or slower depending on the signal that we send. Our visceral motor system, the sympathetic, is originating from T1 to L2. This is called the thoracolumbar division. And the parasympathetic, which is our craniosacral, starts from cranial nerves 3, 7, 9, and 10, and from S2, 3, and 4. This is called our craniosacral. So hopefully this will give you a good summary of all the signals that are either outgoing, that is our motor signals, or incoming, that is our sensory signals. This is the spinal cord model. What we're going to do first is put this model into anatomical position. This is the posterior side, this is the anterior side. How can you tell they look exactly the same? Do you see this bulge here? This is called the dorsal root ganglion. You always find this on the dorsal or posterior surface. From your structures list, you have gray matter, which is gray, and white matter, which is white. We have coming out of the spinal cord these rootlets. On the anterior, these are called your ventral rootlets. On the posterior, these are your dorsal rootlets. Where the two rootlets come together and mix, this region right here, so right between my fingers, this is called the spinal nerve of the spinal nerve. Okay. Then we go out to the ventral ramus, which is very large, and the dorsal ramus on the dorsal side, which is very small. The signals that we have can either be incoming, that is sensory signals. They can be outgoing, that would be motor signals, or they can be mixed, that is both sensory or motor. I want you to imagine that this is like a city. It's a traffic system. What we have here, where my hands are enclosing here, this is our downtown area. The downtown area is very congested, so what we do is we have one-way streets. Here we have our outgoing signals on the ventral rootlets. Here we have our incoming signals on the dorsal rootlets. On the ventral rootlets, we have only outgoing motor signals. We have motor signals that are either somatic motor or visceral motor, but they're only motor. On the posterior or dorsal side, we have incoming signals, that is sensory signals. These signals coming in the dorsal rootlet are either visceral motor, or visceral sensory, or somatic sensory, but they are all sensory signals. When we get out here, okay, from this spinal nerve out, we're in the peripheral nervous system, as opposed to this part here, which was our central nervous system. Once we're in the peripheral nervous system, going back to our city analogy, it's like being in the suburbs. We have two-way signals. We have signals which are both outgoing, and we have signals that are incoming. Where they're going to or from depends on which ramus we use. If we're going to or from the back, we're going to use the dorsal ramus. That can be an outgoing signal to the back. It can be an incoming signal from the back. It can be either sensory or motor, but it is going to and from the back. Here on the ventral ramus, we are going to or from the front and sides. So we have a mixed signal. It can either go to or from either sensory or motor, but it is going to the front or sides of the body. So in this situation, ventral refers to the location, dorsal refers to the location of the incoming and outgoing signal. So what we have here, these are our motor signals. We only have two types of fibers here. We have somatic motor and we have visceral motor. Here we have only two types of fibers. We have visceral sensory and somatic sensory. Once we come out into the mixed spinal nerve, the ventral ramus or the dorsal ramus, we have all four types of signals. So the sensory signals are going to come into this posterior horn. The ventral signals, if it is somatic motor, it is going to be produced here in the anterior or ventral horn. If it is a visceral motor signal, that is a motor signal going to a smooth muscle, cardiac muscle, or gland, it is going to be created right here in this IML column. The IML column only exists between T1 and L2. It does not occur on any other spinal levels. I also have a very short summary of the four types of signals, which will follow this discussion of the model.